Mental health is the catalyst for cognitive and communication skills, as well as emotional growth. It pushes an individual to pursue higher educational achievement, which leads to better opportunities, increased earnings, and be capable to work productively. Thus, mental health aims to have an improved quality of life, realizing one's fullest potential and bringing significant contributions to society. That is why information in health is crucial, as it both acts as a management and a foundation for strategic health behaviors and decisions. On the other hand, communication is an essential input into health programs as a way of disseminating and exchanging information. The communication process enables health practitioners to plan and develop compelling messages to be shared and exchanged over salient channels to provide audience with significant health information to influence their knowledge, attitudes, and behaviors towards their health. Therefore, profound communication strategies are important for any health program to be successful. In addition, the role of mental health practitioners in public hospitals is of paramount importance because they provide critical information and deliver timely, adequate, and relevant communication interventions that enable the public to take control of their mental health. However, the number of patients seeking mental health consultation in the biggest hospital in Ilocos Norte has been increasing in the past years. In addition, Ilocos Norte had the highest suicide cases in Region 1 from January until August of last year. Because of the increasing number of incidents, there is a need to focus on the communication strategies used in mental health promotion. Hence, this research proposal aims to identify the communication strategies, specifically the messages, channels, and approaches that mental health workers in public hospitals use. Evaluate the effectiveness of communication strategies employed to the audience, and describe how relevant the communication strategies are to the audience. That leads to my title, which is Communication Strategies in Promoting Mental Health in Public Hospitals in Ilocos Norte. The social marketing theory, David Berlow's model of communication, the interactive model, and Laswell's model of communication will be used. In social marketing, it considers the 4 techniques, which are the product, the price, the place, and the promotion, and the key concepts such as creating awareness, targeting the right audience who needs the message to match the most effective communication channels and approaches, and that are easily recognizable, understandable, and interesting. Berlow's model of communication focuses on the relationship between the source, who encodes the message, and the receiver, who decodes the message. The source or sender transfers the information to the receiver with the help of communication skills, attitude, and knowledge. The message is the content that is being sent by the source to the receiver. The channel refers to the medium used to send the message from the sender to the receiver. And the receiver is the individual who gets the message sent in the process. The interactive model shares the same elements as Berlow's model with the incorporation of feedback. The receiver becomes the source and encodes another message, which is known as the feedback, and sends it back to the source. Lastly, Laswell's model of communication, which aims to analyze mass communication as well as interpersonal and group communication, will be used. Because of the flow of messages through various channels and approaches, the concept of effect gives a relevant contribution to evaluation studies. The effect of a message can be seen as a feedback. Looking at the conceptual framework, The mental health workers are in essence social marketers because they try to change the behavior of their audience, although they have to consider the techniques and key concepts of social marketing. To create awareness to reach the audience, the message goes through appropriate channels and approaches as seen in Berlow's model of communication and social marketing theory. The message needs to stimulate the audience's interest in a way that it encourages them to promote and even to persuade others to adopt new behaviors or ideas. Moreover, through the interactive model, the audience evaluates the effectiveness of communication strategies. This creates feedback. And lastly, by applying Laswell's communication model, which highlights the concept of effect, the audience evaluates the communication strategies as to relevance to their needs. Methodological triangulation includes different qualitative and/or quantitative methods for data gathering and analysis around a single object of study. This will be used to strengthen the credibility of the research data. Hence, 2 questionnaires and 1 interview guide will be devised. First, using a pre-tested questionnaire, a survey will be done to mental health workers in 8 public hospitals in Ilocos Norte to identify the message, communication channels, and approaches used. Frequency count and Likert scale will be used to measure the responses of the respondents. Second, using a pre-tested questionnaire, a survey will be conducted to audience who have been recipients or receivers to evaluate the effectiveness of the communication strategies used by mental health workers. The respondents will be chosen through random sampling. Likert scale will also be used to measure the responses of the respondents. Third, through judgment sampling, an in-depth interview will be done to the audience to evaluate the relevance of the communication strategies employed. This will be a combination of open-ended with follow-up questions to explore their perspective on a particular idea or situation in depth. This will be recorded and transcribed. Permission from the head of public hospitals and head of agencies will be obtained, and the researcher will ensure that all respondents' participation is voluntary and an informed consent is obtained to the respondents. Both quantitative and qualitative approaches will be utilized. To analyze the message, communication channels, and approaches, all responses will be tallied and calculated. Descriptive statistics will also be used to summarize the communication strategies used by mental health workers in public hospitals. To analyze the data on the audience's evaluation on the effectiveness of communication strategies, weighted mean will be used. And to analyze the relevance of the communication strategies to the audience, the social marketing theory and models will be used to guide in the study framework. Thank you very much and looking forward to a fruitful interaction with you.